Eon Treatment Packages. In this module, we will discuss the different treatment packages offered by Eon and set some general guidelines on how to choose the proper package for your aligner's case. Eon offers 3 different treatment packages: Basic, Plus, and Pro. The packages mainly differ in the number of aligners and refinements provided. Basic package includes 10 aligner steps, 1 free refinement, and 1 free set retainer. You will have a 9 months treatment period. Plus package includes 11 to 24 aligners steps, 3 free refinement, and 1 free set retainer. You will have 18 months treatment period. Pro package includes unlimited number of aligners steps, unlimited number of refinement steps, and 1 free retainer. You will have a 36 months treatment period. So, how do I choose? When submitting your Eon case, you will be required to select the package type for the case as shown here, either Basic, Plus, or Pro. Remember that the main distinction between the packages is the number of aligners. So the first thing to consider is case complexity, which is reflected in the amounts and combinations of different movements planned to reach the final proper alignment, which will eventually determine the number of aligners. The second point to consider is treatment goals. So regardless of the complexity of the case, what am I aiming to correct in this treatment? The first point to discuss is case complexity. Remember that Eon treatment setups are planned according to specific rates for each type of movement per aligner. For example, rotational movement is done at a rate of 2.5 millimeters per aligner. So if we are planning to rotate a canine, say with 40 degrees rotation, for example, then we have exceeded the number of 10 aligners provided in the basic package. The same goes for cases where extrusion, intrusion, expansion, or retraction movements are required. So the first guide is the amount of movements needed. The next point to consider is the combinations of different movements. For example, if we are planning proclination and extrusion for a specific tooth, then those 2 movements are antagonistic and cannot be done simultaneously. So proclination is planned first and then extrusion, each in its predictable rate of movement per step. So even if the amount of each movement alone can be achieved in 10 aligners, the 2 movements together need to be separated, which will increase the number of aligners and affect the choice of the treatment package. The second variable is treatment goals. Sometimes, even in advanced cases, the treatment is intended to correct some minor malalignment or crowding in the front segment, for example. Let's think of a patient with a Class 2 relationship and increased overjet. To fully correct a Class 2 with distalization and retraction, this will require a Pro package to accommodate the higher number of aligners needed for those movements. But sometimes, treatment objectives will be to accept the Class 2 relationships and increased overjet, and aim to correct the minor front teeth misalignment only, which will work as a Basic or Plus package. So treatment goals are also an important factor in determining treatment packages despite case complexity. Now let's look at some general guidelines that will categorize the cases treated in each package. Basic is usually indicated for cases of mild orthodontic relapses, very mild spacing and crowding. Indications for Plus cases generally include mild to moderate spacing and crowding, up to 5 millimeters, mild to moderate deep bite, mild to moderate anterior open bite, up to 3 millimeters, increased overjet, up to 4 millimeters, mild to moderate anterior or posterior dental crossbite. As for Pro packages, those are indicated for more advanced cases, such as severe crowding and spacing, severe deep bite, severe anterior open bite, antero-posterior discrepancy correction, extraction cases. Remember, this is just a general guide on how to decide what package is needed for treatment. But if in doubt, no need to worry, as Eon's treatment planning team will update you if changes to the packages were needed to accommodate the movements and treatment goals. You will receive an inbox message about any of those changes if applied. So what are the factors that will be considered when upgrading a case? Upgrade will be advised if the rate of movements applied was very aggressive to stay within the limit of Basic or Plus package. This will affect the tracking of the case and the final result. Thus, an upgrade will be advised or applied. when treatment objectives cannot be met within the chosen package because of the limited number of aligners. And last, when the final result is compromised due to the restricted number of aligners, then an upgrade is advised as well to achieve better results. Now let's look at some examples of different cases and what type of package to choose for their treatment. This is a case of mild spacing in the upper and lower arches, with stable posterior occlusion of Class 1 molars and canines, and with good overjet and overbite. The treatment plan would include retraction of upper and lower anterior teeth to fully close spaces. So generally speaking, mild spacing like this here can be treated within the basic package. This is a case of moderate spacing in upper and lower arches. The case can be treated with a plus package to accommodate the amount of retraction needed to close upper and lower spaces. Remember that retraction movements are done within the range of 0.2 millimeters per step. In addition, some other movements were combined, such as mesiodistal uprighting of the upper central incisor, all of which requires that the case be treated as plus. Next is a case for mild lower anterior crowding with stable posterior occlusion of a Class 1. Treatment would address anterior teeth alignment and relief of crowding with a basic package. Here we see another example of a more advanced case of upper and lower anterior crowding with tipped central incisors. A plus package would be a suitable choice to accommodate the movements required, such as posterior teeth expansion, uprighting of upper centrals, and relief of the crowding and alignment. This is a case of a deep bite along with favorable spacing in the upper arch that can be treated with a plus package. Notice that intrusion is a movement that needs space, so intrusion and space closure can be achieved simultaneously to close upper spaces and improve the deep bite in this case. This is a case of moderate deep bite complicated by upper and lower arch crowding. Such a case would require a pro package. Generally speaking, cases of anterior open bite which require extrusions of anterior teeth of more than 2 millimeters will require more than just 10 aligners, especially if accompanied with other malocclusions, as extrusion is usually done towards the end of treatment when alignment is almost achieved with a rate of no more than 0.15 per aligner. However, in some mild cases like this one here, where the open bite is localized around the upper left lateral, treatment is doable with a plus package. Here is a more advanced open bite case, where treatment required extrusion of upper and lower front teeth to achieve proper overbite. Next is midline discrepancies, when a very minimal shift of less than 1 millimeter is present. A plus package can be sufficient to achieve midline correction, with some IPR to create space and front teeth movement, of course, if other combined movements are minimal as well. More complex cases of midline discrepancies, like this one here, will require more advanced movements, including posterior teeth movement in most cases, mesialization and distalization, which will need an increased number of aligners and a pro package for treatment. This is a table to summarize the general guidelines followed when deciding on the best treatment package for your aligners case. Thank you for watching.